Yeah, and when you're talking about innovation in terms of helping reduce the administrative pain or helping more claims get paid, what are some of those common technical challenges in the new practices are inundated with these choices of systems and this broader ecosystem of building companies or clearinghouses and insurance companies? What are some of the common big technical or non-technical challenges that those providers face?
Yeah, it's a great question. I mean, I think in the outpatient segment, you really got to focus on their billing teams, whether the billing teams sit in-house or externally. Let's just say either or, because the providers aren't actually working with the insurance companies. There's the billing teams that are doing it, and so I think the biggest challenge. Let's just say it's an in-house team. You're a 100-person surgery group, and you've got a team of 50 people collecting revenue for you. I think the challenge is twofold. If you're the providers or the leadership team, it's like, what is that team exactly doing, and how do I even understand or follow what they're doing? There's a visibility problem, which leads to a management. What's the famous saying? You can only manage what you could measure, or something like that, right? So
Right.
it's very difficult to manage what you can't measure. So there's a visibility challenge there at the highest level. Then for the actual folks collecting revenue, there becomes this. They can only be as efficient as the system they're working on allows them to be. So when I mentioned earlier that there's all these 4,000 health plans and they're sending you these different responses, if I don't have a system that helps me filter that and triage all these responses from disparate health plans and payers, then I'm doing things manually, right? You're looking at claims one by one. So the system is what we look at. The technological system that a billing team works with is the foundation to the entire collection operation. It's like you're building a house. It's the concrete. The concrete's not there. That foundation dictates what kind of house you're going to build. And I would go a step further. The reason I'm personally and our team is so passionate about automating in this segment is I would argue that the financial and revenue cycle aspect is the foundation for the entire healthcare system all the way through. Even more than the clinical stuff is that you got to have that stuff in order. So I'd say that the biggest, broadly speaking, like how do I interpret all this information that's coming to me as a billing team?
Right.
That's the biggest thing.